I wanted to find out from you too. I know there's been a huge push with minimally invasive treatments and procedures as well. Have you incorporated those into your practice as well?
Well, so are we talking about gynecomastia now or just other procedures?
Just other procedures, so any of like the injectables or anything like that.
Yeah, so I would call that non-invasive with injectables. So I have a large practice also in facial rejuvenation, and patients will come in and they'll say, "Hey, I'm looking in the mirror, I'm looking older," and I think, "Hey, can you do something?" So generally, interestingly, when we look at each other, we're looking in the eyes.
Mm.
So when we look here,
Yeah.
that's the part we notice most about people. But when we look at ourselves in the mirror, we look down here. So a lot of people come in, they'll say, "Hey, can you do a facelift?" And I'll say, "Sure, I can do a facelift. What are your goals?" Well, I want to look more rested. I want to look better. And so a facelift will tighten the neckline, but it doesn't replace the volume loss around the face. So aging is very interesting. We lose muscle and fat and soft tissue as we age. And so we're really kind of deflating as we age. And so now we have some really good fillers that we can very carefully replace the volume with. And when we can do it step by step in the office in a way that looks extremely natural. And we have new fillers now. There's the resilient hyaluronic acid fillers that are very strong and flexible, so they move with the face. So people have gotten the idea that the cheeks are flat, we should add some volume, but a lot of patients will come in, they've been to a spa or been to someplace, and they have these funny apple cheeks where they smile, the cheeks look bunchy, and you only notice the bad ones. You never notice the good ones, and so the uh, resilient hyaluronic acid fillers, which have been brought to this country by Revance and have been here for, it'll be 2 years this November, have really, I think, revolutionized treating parts of the face that move, because we don't just want it to look better at rest. We
Right.
want it to look better as people move. And so it really gives me some tools now where I can go in and add volume back to replace it. And I like to leave it underdone rather than overdone, because underdone looks normal and overdone looks funny from across the room,
Right.
and my patients are professional men and women in New England, and they want to look normal. So that's been really very exciting, where we can take somebody that and I can do a lot of facelifts as well, but I'll have patients that have had a facelift somewhere else where they're actually disappointed because it didn't treat the central areas of their face. And I'll say, well, it doesn't treat the central areas of the face. And your doctor did what you asked, it just wasn't the right thing. So it's really important when people ask for a specific procedure to really first make the diagnosis. What's the problem? What are the options? And really, where are the low-hanging fruit? Where are the things that we can make better, the quickest
Mm.
with the most impact at the least cost for patients when they come in. So that's been very exciting. And we have a very large experience now with the flexible fillers, and the nice thing about them is that they're reversible. So I was a resident at the University of Michigan, and we were one of the test sites for liquid silicone to treat Romberg's hemifacial atrophy. So Romberg's disease is an area like a lupus where fat goes away in the face, people come with dents of the face. And we were close to Midland, Michigan, where Dow Corning was. So they said, let's test silicone. And it worked great. It looked great. But now, 8 or 9 years later, which is now when I'm a resident at the University of Michigan, all these patients started coming back with chronic inflammation problems that you couldn't treat. So that really taught me early in my career, you don't want to put something in that you can't take out. I still have patients that come in, their fillers on the market today that are not reversible. So the first principle is you want to do something that, if you have a rare problem with it, and it's rare with the newer fillers, you can reverse it. So the non-animal stabilized hyaluronic acid fillers are reversible. We can dissolve them with hyaluronidase. So that's really nice to know. And I'll have patients call me in a panic because they went to see an obstetrician, had some filler put in their face, and they read online afterwards, oh, it's permanent. They call me and say, can you remove it? I said, no, I can't remove it. It's permanent. That's why we don't use it. So I think it's important. So we have a lot of good tools now, and some exciting new tools coming on the market.
Awesome. Yeah, that's really great to hear. And do you usually like to use those in conjunction with procedures, or do you feel like patients typically get the results they're looking for just using those on their own?
Well, so I think that I sit down when somebody comes in that says, I'm looking tired. We make a diagnosis. Okay, do they have angry lines? that make them look mad when they walk into a room, and sometimes just a little Botox can relax those. So people may not try to look mad, but they may be sending this message of being angry, and so there are ways to correct that. And so well, there's some people that come in and they've got a big turkey neck, and you can't fix that without surgery, but there are other things that can really help to meet somebody's needs. And simple is always better. If you can make somebody feel better with something that isn't surgery, then I think it's better than surgery. And I think that my practice is probably like most around the country. I'd say that we have 10 times as many non-surgical procedures in the face as we have surgical procedures, because we have a lot now that we can offer patients that helps to meet their needs and correct some of the problems that they have.
Yeah, that's great to hear. And how often do patients need to, come back in and have the treatments done again? How long do the results last with each one?
Well, that's a really interesting question, because if you've been watching the news, there's the brand new long-acting botulinum toxin has just been approved by the FDA. So Daxxify has a special molecule, and it's really different. So I'll kind of elaborate here a little bit, but generally Botox lasts 3 to 4 months. And if you use a much larger dose, sometimes it'll last a little bit longer, but 3 to 4 months. So most patients come in every 3 to 4 months to repeat their Botox. The non-animal stabilized hyaluronic acid fillers that we have now usually last, depending on where we use them, and depending on which ones we use. There's some that we use in the lips that are super soft, so they look natural and don't look like duck lips or the trout pout, and they last a year or so. But the fillers that we use in the cheeks along the nasolabial creases usually last 22 months. So they can be very durable for patients. So you may do more kind of steps at first to get them kind of up to a normal volume, and then just little bits for maintenance. Now the nice thing is going to be with the Daxxify that it seems like it lasts 6 months. So it's the first long-acting botulinum toxin to be approved by the FDA. So all the other toxins on the market, the Zomin, Dysport, Jeuveau, really were kind of like Botox. They kind of tried to sell for less in the marketplace, but they really weren't any different. And so this is the first time that we have one that's truly different. And I asked my patients, I said, would you rather come and see me every 3 to 4 months or every 6 months? And they're like, hey, Dr. Hall, I like you, you're a good guy and everything, but if I can only come in twice a year instead of coming in 3 or 4 times a year, what's the question? And so it's going to be very exciting. We're going to be one of the first practices in the area to have access as a premier practice to preview the Daxxify in the office. And so I'm very excited. Most of my patients, I'll have a few patients that'll say, well, I don't know if I want to try something new. And the answer to that is that in the studies, the side effects, mainly drooping of the eyelids, isn't any higher with the Daxxify than it is with the Botox. And you wouldn't want to go to have a new treatment with somebody that wasn't as experienced, because the effects are going to last longer. So if you don't have a good effect, it's going to last longer. But most of my patients are thrilled to be able to only come in every 6 months instead, if it works out the way that the early studies are showing.
Sure. Yeah, that definitely makes a lot of sense. And with that as well, who do you look for as far as who you feel like is going to be a good candidate for it? Is that just people that have those lines and kind of just wrinkles and trying to restore that lost volume?
Well, so lost volume is easy to replace. Skin damage from sun and smoking is not easy to fix. And so people can use Retin-A to help. So there's the skin, which is kind of like the fabric, and then there's the volume underneath. So
Sure.
it's easy to replace lost volume, and as patients have more lost volume, they may need more volume to replace it. But if I could get somebody when they're in their 20s and say, don't smoke, and protect your face from the sun, those are two big messages for everybody that really help to preserve your appearance. But the volume loss with aging, those are things now that are again have to be done artistically and really, as I tell patients, all of these fillers are really just a set of paints. It's who's holding the paintbrush that's important. So you really want to see somebody that's really experienced in surgery and non-surgery, that understands the aging changes that happen, so that they can decide what's going to be better for you, the non-surgical, the surgical, or a combination of both.
Yeah, and I think a great point you made too is you're looking for a result that's looks natural too. You don't want people to know that you've had it done. It should look like it's just a rejuvenated appearance, like you were saying.
Well, that's honestly true regardless. I see a lot of breast implant patients, and the first, and my patients are professional women in New England. They're not pole dancers, and uh, they'll say, please don't make me look like Pamela Anderson, and their families and their spouses or boyfriends are thinking, why would you want to do that? Thinking, because we only notice the bad ones. You only notice the bad results. You don't notice the natural results. And I'll frequently hear somebody that'll come in and I'll say, how'd you get my name? They'll say, well, I was in the hot tub with Susie, and I told Susie she's lucky she never had to have breast implants. And Susie said, no, I had breast implants 5 years ago with Dr. Hall. And she'll say, I never noticed, because it's very important when you size somebody for breast implants that breast implant isn't wider than their existing breast and that it fits their frame. And so when you do that well, the best surgery, you can't tell. My biggest compliment as a plastic surgeon is when a patient comes back and says, yeah, somebody asked me if I had my hair cut or if I've been on vacation, because they associate those things with looking better. So they know that the patient looks better, but they're not sure why. So whether it's a rhinoplasty or a breast augmentation or a facelift, we don't want somebody to look like they've had surgery. We're trying to correct deformities, not create deformities. And it's the same thing with fillers or with lip rejuvenation. You don't notice the good ones, you only notice the bad ones. You're almost staring like a car crash. You see somebody in a room, you go, oh my gosh, that looks horrible, and it's not normal. And that's, patients don't want that. So as soon as you talk about those areas, the first thing they say is, I don't want to look like that person.
Right. Yeah, definitely. Yeah. Do you feel like, most patients that end up getting those results are because, that's what they were really asking for? Or is it just because, they maybe went to see somebody who wasn't as experienced and qualified with it?
I I have patients that come in sometimes and ask me for things, and I'll say no, because I don't think that you and I are going to be happy when we get done. I don't think what you're hoping for is what we can achieve, or I don't think I can get a good enough result that most people are going to be happy. I can't promise happiness, but I know now, after 30 years, 32 years in practice, what things are how they're likely to go and how they're likely to turn out, and whether it's worthwhile or not. So I don't think patients go to a doctor and say, I want to look weird when I finish. I think people are hoping to look better, and there are some people that have an unusual sense of what's normal. We call that body dysmorphic syndrome, or they don't have a normal view of their face. And maybe some people want an overly stuffed lip or breast to kind of stand out for whatever reason. But I find that for the most patients, they want to look better, and they feel better when they look better. They don't want to look funny. Nobody wants to be that person that everybody in the room is pointing at and saying, ooh, I don't want to look like that person.
Yeah, definitely. Yeah, that's good to hear that, most patients have pretty realistic expectations and goals of what they're trying to achieve with that.
Yeah, and sometimes people come in, and so especially when we're talking about facial rejuvenation, I'll tell people, we'll start with a step. We'll treat the low-hanging fruit, the things that are going to make you look better first, and then we'll come back and maybe we'll do a little bit more. And people are like, wow, that looked good. Can I do a little bit more? And when we get to a point where I'm looking at them thinking, nah, if we do more, it's going to look funny, then I say no. And so we have a, with a lot of my long-term patients, we have a really good conversation in the office of, what's bothering you? This is what I see. This is what I think is going to be the most beneficial. And I read once that what people really want in a doctor is a friend with special knowledge. You want somebody that's have their interest, but has their knowledge, but your best interest at heart.
Yeah, absolutely. I think that's a great way to look at it. Yeah, and I think a lot of patients might get kind of that body dysmorphia just from like social media and having pictures that are filters and edits and everything, and think
Oh,
that
sure.
that's how people actually look in real life. But if you see that person, it's not really a result that you can actually get in person.
Or somebody comes in and with their body type, you can't get a certain type of look, and Brazilian butt lifts are probably, I don't generally do those in my office because it's more what you can take away than what you can add. But somebody that's thin and skinny is not going to have a lasting fullness by adding lots of fat in the buttock area. And if they did, what happens in 5 years when they gain weight? Where does that go? And a lot of the results that you see on the internet or even see at the meetings are not results. People show you the result on the table. They don't show results at a year,
Yeah.
you know, so you really have to, I think, try to treat people the way you'd want to be treated and how you would treat a family member. If you don't think it's a good procedure for your sister or your mom or your brother, then you probably shouldn't do it for a patient.
Yeah, absolutely. That's a great point. And for patients that are local to you guys there in Massachusetts, what would be the best way for them to get in contact with you?
Yeah, so we're on the internet, drjhall.com. It's our website, and we actually will do what's called a virtual consultation. So some people aren't really sure, if there's something we can help or what to do, and so they'll send us pictures, and we'll look at them and say, yeah, I think we can do this, this, and this coming in for a formal visit. So that's a nice way to start. Our phone number is 781-279-7930, and people call the office. And a lot of people are pretty sophisticated, have a pretty good idea what they think is going to work for them. But as I tell patients, sometimes their treatment plan could be incorrect. I mean, nobody goes to their cardiologist and says, I need a this, this, and this. People go to the heart doctor and say, these are my symptoms. What do you think I should do? And I think usually it's better with the plastic surgeons, you have kind of an idea, but I usually try to push people back to, what's bothering you? What are you seeing? And then this is what I'm seeing, and these are the things that if we correct, I think you're going to have a good result.
Yeah, I think that's a great way to look at it too. You're having patients actually get the results they want, and they're fixing those issues, as opposed to, if they come in and they think that one procedure treatment's going to be what it is, and that might not be what they need exactly.
Right, exactly. And realistically, everybody's got a different level of expertise. If you go to your accountant or your attorney or whatever, I may not understand everything they're talking about, but I can kind of understand enough to think, okay, they seem like they know what they're talking about, and they seem like they have my best interest at heart, and
Right.
and they so I think that, yeah, what's bothering somebody, what's the diagnosis? The diagnosis should always come before the treatment. So when somebody comes in and says, I want and I see patients that come in that were in another office and they asked that for the doctor for that procedure, and the doctor did it. And I'll ask those doctors, why'd you do that if you knew it wasn't going to turn out well? And I've heard, well, if I didn't do it, somebody else would. So, I just thought I'd go ahead and do it. It's like, no, you should explain to patients why it's not in their best interest and not do it. But it happens, unfortunately. No, I think most of my colleagues are pretty honest and ethical and are really trying to do what's best for a patient. But you really have to kind of understand what's bothering somebody, and are there things that we can improve and make it better?
Yeah, absolutely. And I was hoping you could kind of just give some advice to patients that are maybe trying to figure out, what plastic surgeon they could go to, and what are some things they could look for to try to determine if they're, going to be a good fit for them.
Mhm. Well, I think that as in any relationship, you have to have a doctor that you feel comfortable with, that you feel is listening to you, and that you can talk with and share what's going on. Because medical tourism, people call up and say, hey, I went to Brazil and I had a abdominoplasty and now I'm having a problem. It's like, well, go back and see your doctor. I mean, you need a doctor that will be there for you for the treatment and for afterwards. And so medical tourism is not a good idea. I think that there are some general reviews out there. Boston Magazine has a list of top doctors every year. I'm humbled that I've been chosen by my colleagues as a doctor they'd want to take care of their families in the last 10 or 12 years in a row in Boston Magazine. But I'm actually even prouder that I was chosen the last 10 years by other patients as a compassionate doctor. So I think that do your research, look online, people read reviews, but don't take all of them literally. I'll have people that slam me on reviews because I explained to them why they wouldn't be a good candidate for a procedure they thought they needed. And but I think that look, the best way to find a doctor is word of mouth from a friend, but most patients find you online now, and like everything else, they do their research online.
Sure, definitely. Yeah, well, it's really clear to see from talking to you that you care a lot about the patients and you just want to see them get, the best result possible as long as it's something that can actually be achieved with those procedures and treatments.
Well, thanks, Caleb.
Yeah, definitely. All right, yeah, well, those were the, questions I had for you today. So I really appreciate you taking the time to, talk with us and share the education on that.
Great. Well, I enjoyed talking to you, and I'm glad things are warmer in Arizona, and you enjoy your travels coming up.
All right, awesome. I appreciate it. Have a great rest of your day.
All right, take care.